We've been talking about the fight for life ongoing on multiple fronts, as we know, and the challenges. There are many challenges for pro-lifers on those fronts as well. And also is one thing that's a big challenge is that accessibility to a method of abortion that some 60% of women use to end the life of their babies. That drug is called Mifepristone.
That's right. In the last decade, it has become more and more accessible. Legally, that fight has taken a few twists and turns. ewtn News' Roselle Reyes gives us a look at the years-long effort to ban this dangerous drug.
Mifepristone, more commonly known as the abortion pill, continues to be readily available nationwide after the Supreme Court's ruling last year that preserved access to this medication. According to new data from abortion think tank the Guttmacher Institute, there were approximately 642,700 medication abortions in the United States in 2023, accounting for 63% of all U.S. abortions. Trends suggest that reliance on mifepristone will continue to increase as it has become more accessible over time.
Chemical abortion is the present of abortion. It's also the future of abortion. It's easier to access. It's easier to take, especially if you can get it at any local CVS or Walgreens. Take it in the privacy of your home without having to go to a clinic or schedule an appointment. But that's going to lead to a lot more complications and issues.
The Food and Drug Administration first approved mifepristone in 2000 to end pregnancies through 7 weeks, which later was extended to 10 weeks in 2016. FDA continued to loosen restrictions in 2019 when the agency lifted the in-person requirement to obtain mifepristone, allowing patients to receive the medication by mail. For years, pro-life doctors have been speaking out about the dangers of mifepristone.
We really need to emphasize to women that chemical abortion drugs are not safe. And the further in pregnancy, the less safe they are. The FDA never required an ultrasound. They never required the basic safety requirements.
In 2021, Charlotte Lozier Institute scholars analyzed 17 years of Medicaid claims data. They discovered that between 1999 and 2015, there were 430,000 confirmed medical abortions and 121,283 confirmed subsequent visits to an emergency room within 30 days of the abortion.
There was a 500% increase in women presenting with complications, which mirrors the rapid increase in the use of chemical abortion.
Dr. Ingrid Skop, an OBGYN in Texas who serves as Director of Medical Affairs at Charlotte Lozier Institute, has personally seen the horrors of chemical abortion. She has performed at least a dozen surgeries on women who experienced complications when abortion pills failed.
I had to do surgery on another woman who had obtained an abortion in California. Because it's illegal in Texas, and yet she came to Texas, she had her complication in Texas, and I took care of her there.
In 2022, the Alliance for Hippocratic Medicine and other anti-abortion advocates filed a lawsuit in Texas challenging the FDA's approval of mifepristone. In the meantime, due to COVID restrictions, the FDA officially allowed certified pharmacies to dispense mifepristone in person or by mail to those who have a prescription. The lawsuit ended up in the Supreme Court last year after hearing oral arguments about access to mifepristone. The 9 justices ruled that the Alliance for Hippocratic Medicine lacked the legal right to sue over the FDA's approval of mifepristone.
In this unanimous ruling, the court decided that the pro-life doctors and medical associations who brought this lawsuit against the FDA simply didn't have that kind of direct connection because, as you mentioned, they don't prescribe mifepristone, they don't use it with their patients, they do not provide abortions. But that doesn't mean that other plaintiffs might not be able to bring a case back to the courts, but they'll just have to do it with different plaintiffs.
That is exactly what 3 states are doing to continue the legal fight. Since the Supreme Court did not rule on the exact issue in the case, which is the legality of FDA's actions on mifepristone, a revised lawsuit was filed by state attorney generals in Missouri, Idaho, and Kansas. It seeks to reverse regulatory changes the FDA has made since 2016 that expanded access to mifepristone. It also asks for new restrictions, such as banning the drug's use after 7 weeks of pregnancy instead of 10. And for federal regulators to require 3 in-person doctor's office visits before people can access the drug. As of October, the court has not yet ruled on whether it will accept the state's amended complaint. Fiorito explained that the fight against mifepristone can and should move forward to save the lives of women and the unborn.
These are very dangerous drugs. And when you look at them in the context of how they are used and prescribed in the United States right now, no in-person doctor visits. They can be sent through the mail. I mean, the potential for harm to pregnant women is really significant.
So far, at least 14 states have restricted access to mifepristone, such as banning the mailing of the drug, mandating in-person appointments, and limiting who can prescribe mifepristone. Roselle Reyes, EWTN News.